I'm Larry Kestin. I am a radiation oncologist, the medical director at MHP Radiation Oncology Institute in the Detroit, Michigan area, part of MHP or Michigan Healthcare Professionals, and also an affiliate of Genesis Care. The primary use for radiation treatment in small cell lung cancer is thoracic radiation treatment given concurrently with chemotherapy for limited stage small cell lung cancer. In that situation, I typically treat the known disease based on imaging studies, CT scan, PET scan, with no elective lymph node treatment. And I typically use the classic hyperfractionated regimen of 45 gray and 1.5 gray fractions twice daily. That's commonly known as the regimen from the PrecisCa intergroup trial, as it demonstrated higher survival rates than once daily fractionation. So I tend to still use that regimen, especially also based on the more recent results of the CONVERT trial. Secondly, besides thoracic radiation for limited stage, another very common indication would be prophylactic cranial irradiation for either limited stage or extensive stage small cell lung cancer. It was the standard for a very long time for limited stage. More recently, it's come into question a little bit because of a study that showed that maybe you could do MRI surveillance every 3 months and avoid it and avoid any potential neurocognitive side effects. I still, for the most part, routinely use it, but I have a long conversation with my patients about the positives and negatives. And then also now it's often used for extensive stage, prophylactic cranial radiation also for extensive stage. There are some other applications. More recently, studies have shown that if you add thoracic radiation treatment after chemotherapy for extensive stage small cell lung cancer, that there can be a survival benefit. There are some nuances to those situations that apply, but I typically consider that. And if I'm seeing a patient with extensive stage early on and send them back to begin chemotherapy, I will usually see them after chemotherapy to see the response and see if it's warranted to give thoracic radiation treatment after chemotherapy.